And now, broadcasting on StarWorldWideNetworks.com, it's time for the Cannabis Reporter Radio Show with Snowden Bishop. Listen in as Snowden interviews cannabis industry pioneers, marijuana experts, policymakers, medical practitioners, patients, and other amazing individuals with compelling stories to share. It all happens right now. Here's the Cannabis Reporter, Snowden Bishop.
Welcome back, and thanks for joining us today. We're going to switch gears and talk about the devastating impact opioid pharmaceuticals have had on our society. What you may not know is that more than 2 million Americans are addicted to opioid painkillers. Every day in the U.S., 78 people die because of an overdose. With millions of narcotic pills dispensed annually to manage pain caused by football injuries, the NFL community has been disproportionately hard hit by the staggering rise of addiction and premature deaths caused by these overdoses. In a study conducted by Washington University and ESPN, a survey of 644 former NFL players found that more than half were frequently prescribed opioids during their career. And of those, 71% reported that they had struggled with some form of addiction. That's an unwelcome side effect that only compounds already debilitating chronic conditions. Despite the evidence that medical marijuana helps to mitigate inflammation, aches, and pains, and helps players to manage neurological issues and memory loss associated with their injuries, NFL players are barred from using it, even in states where it's legal. A growing number of current and former NFL players are calling for an end to the overprescribing of these dangerous drugs and are advocating for legal use of cannabis to treat their football injuries instead. The medical community has been slow to embrace this as a viable alternative, but thanks to the efforts of people like my guest today, that may be changing. So first I'd like to introduce Dr. David Tokin. He's one of the nation's premier pain management specialists with board certifications in anesthesiology and pain management. Welcome, Dr. Tokin. Thanks for being here.
Good afternoon, Snowden. How are you?
Doing well, thank you. And I'd also like to introduce our other guest. This is an 11-year veteran of the NFL and a Super Bowl star, Marvin Washington, who played for the New York Jets, San Francisco 49ers, and the Denver Broncos. And that's in addition to your college career, correct?
Yeah, thanks for having me. I won a Super Bowl on the Broncos. I know about a Super Bowl star, but I was certainly part of that team in '98. But thanks for the kind introduction.
Well, I tell you what, anybody who played for the NFL is a star in my eyes, and to be in the Super Bowl is even, doubly celestial. So congratulations to you for that. It's quite a feat.
No, I appreciate it.
Yeah, but
I appreciate it.
Yeah, well, I know that you've got firsthand knowledge of what goes on in the NFL treating the injuries because, as a contact sport, it's probably one of the most brutal as far as I know. You're well informed about the issue, and you're now quite an advocate for cannabis being used as an alternative in pain management and also for CTE and that sort of thing. How did you come to become such an advocate?
Well, it happened. I was networking, and I didn't know anything about it. My outlook on marijuana at the time was like recreational, and the stuff that you get from the government, reefer madness, and it had been shaped by that. And then I met two guys that had their cannabis company, and then they had a patent from the government to study CBD as a antioxidant and neuroprotectant from the brain. And being with those guys and going to conferences and get myself educated on the benefits of the cannabis plant, it was a no-brainer. And the thing to me, if there's ever a sport that needs to experiment or look at marijuana for pain management and for treatment of the brain, it's football. And football is the biggest sport in America, and the NFL is the biggest league in the world. And when they move, they can move the whole industry. And this is one of the things that I'm trying to do is, number one, is to educate the public on the benefits of the cannabis plant. Number two is to change the negative connotation of, the use of cannabis, because it has been it has been, with a lot of negative things about it, and I just think the prohibition should end. We need to research it and get the benefits out of it because, for it to be illegal, the reason why it was illegal is ridiculous, and I see this as a movement, and I think it's going to happen within the very near future.
Yeah, well, the stigma has been going on for 80 years or so, and I think that once people like you who are in the public eye a lot are advocating for this, and also as doctors begin to actually embrace cannabis as an alternative, I think that the minds will start changing. But Dr. Tokin, do you treat a lot of football injuries?
Not, to tell you the truth, not really. Actually, we just treat the public. We have many athletes that actually come in here, but not at the level Mr. Washington was at. I actually have one of our friends who's going to be on the round table this weekend, Josh Kinney. He's a professional baseball player, just retired with the World Series ring and things. But, I think one of the problems I think Mr. Washington definitely alluded to was the stigma. Growing up, in the middle of nowhere in Pennsylvania, and then just learning that marijuana is a bad thing, it's very, very hard to get over that stigma. And as a physician, it's very, very difficult. The problem I think we get down to is, Mr. Washington will attest to, is when these players do get injured, or just the layman gets injured, narcotics are prescribed to these patients, and 1 out of 4 people become addicted to these medications, where CBD and things like that, there's no addictive potential to the CBD at all. So I think at some point the medical community is going to have to look at all the research that's being done currently and everything in the past, and it's overwhelming the benefits you can get from CBD.
Yeah, and as a doctor as well, because you're licensed nationally, it's very difficult for you to be able to actually you can't write a prescription for it federally. Isn't that correct?
That's correct. I have licensed in 14 states, and some of them do have medical marijuana, and some of them don't. Whenever I contact and I work with the DEA on pill mill cases and things like that, and when I ask them if they've ever arrested a physician, no one has ever said, yes, we have, but it is still a federal crime to prescribe marijuana. So the good thing is the CBD, if obtained in the right channels, is legal throughout the United States.
Right. It's not legal to grow hemp, but it's legal to consume hemp derivative products like hemp seeds, and they use it as protein powder and all sorts of other nutritional supplements. But so have you been working with a lot of patients with cannabis personally?
Actually, we've been working quite a bit with CBD. We actually, in the pain clinic, we treat all kinds of chronic pain. We also treat addiction. And just recently, we've been giving, thanks to Isodiol, who donated some CBD, we actually gave 20 patients who have chronic pain, including back surgeries, and also people that have opioid use disorder and addiction problem. And in the last 2 weeks, we've seen a 30 to 60% decrease in the amount of opioids that the patients had to take. And also the patients that had opioid use disorder or addiction, 4 out of the 10 don't even take Suboxone or any kind of buprenorphine product because all the cravings are taken away with the CBD. So we've been using it in our clinics across the country for both pain and addiction.
Wow. And it's unusual to hear that because a lot of people believe that the THC is what removes the pain, but it's not necessarily the case.
No, and actually I've been into a couple labs in Colorado where they actually do scientific testing on rats, and it's pretty amazing. It's the same kind of scientific testing they do in pharmaceutical companies, and it's amazing. Obviously the animals aren't biased on these things, but the medication actually exists. And this weekend, actually, the gentleman I was speaking to, Josh Kinney, the guy who played for the St. Louis Cardinals, he actually just called me last night, and he twisted his knee, and it was all swollen. He put actually transdermal cream on his knee, and it feels better. It's very, very hard to believe as a physician that this stuff actually works, but scientifically it works. Studies prove it, and also I've seen it in all of our patients in our clinic. So It is actually a legit form of treating pain and opioid use disorder.
Yeah, and I'll get back to you, Marvin, in just a moment. But Dr. Tokin, as a physician, you know very well about the endocannabinoid system in the human body. So when you're in medical school and you're studying about this particular system in your body, doesn't it seem to make sense that cannabis is naturally helpful to that system?
You know, I know I sound on the radio, I sound like I'm about 18 years old, but I'm 48 years old. And back in medical school, they actually never brought up the endocannabinoid system.
Really?
And, actually, whenever you're in medical school, the studies show that you get less than 6 hours of any kind of training regarding pain medications. So over the last, I think since December of 2015, after the federal government did some subsidizing and kind of put pressure on medical schools, there's over 60 medical schools now training their medical students about proper prescribing of opioids in general, following those CDC guidelines that came out in March or May. And then I think it was 191 nursing schools came out with it, actually trained. So I think one of the big problems, I always, not to pick on Detroit, Michigan, because I actually did my fellowship up in Detroit, but everybody thinks that all these opioids and things are actually coming from the inner cities like Detroit or Mexico, but it's actually the gatekeepers. It's the physicians ourselves that are actually potentiating the problem with this opioid use disorder. Most of the medications, 2/3 of them are prescribed medications people are becoming addicted to. So it's the physicians that need trained and better educated. And the best thing is there's alternatives to using opioids, which are deadly medications.
Wow. Well, it certainly makes sense that education is going to be key along the way. Marvin, back to you. In the locker room, when you have obviously physicians who work with the teams, correct?
Correct.
Yeah.
Correct. They're called the team doctor, which is something else that the NFL has to change because you can't serve two masters at the same time. And if the team doctor is being paid by the team, then, of course, he's going to put the team priority above the player's priority.
Right.
But that's a subject for another time.
Yeah. I'm sure we could go on and on about that. But how often in your career were you prescribed opioids?
For me, it became a regular regimen, after I became, established in the league after my third or fourth year, because you start off in training camp and you're banging, and even they're doing it today, not as much, but, no matter what type of wind sprints and all that things that you do in the off season, once you get into training camp and you're going to get somebody physically, then for me, it started out with the anti-inflammatory, be it Indocin or naproxen, and then once you get into the regular season, you start to get banged up, and whether it's taking a Toradol shot before the game, or it's taking Percocets or Tylenol 3, or whatever other pain medicine or pain blocker that you take after a game. And then, you have a couple of days off, but in those couple of days off, you definitely want to take your anti-inflammatory, and, so you can get through practices and get through the week and get ready to play the game, and you do what you have to do. But I know that, there are players in the league, because I'm still kind of close with a lot of players in the league. I know there are a lot of players in the league that are vaping with some high grade and Indocin, indica, that hits their body instead of taking, Indocin or naproxen as an anti-inflammatory, and they go to practice the next day when there's no negative side effects. So for me, it was, 10 to 11 year, regimen of anti-inflammatory and pain management or pain pills to get through an NFL season, because, baseball and basketball, those are contact sports. Football is a collision sport. And they had a general manager for the Buffalo Bills that slipped up this offseason, and he retracted a couple of days later. But it's a true statement. The human body was not made for football.
Right.
And that's one of the things that NFL players deal with while they're playing, and especially after they're playing, is dealing with, the after effects of having so many collisions during their career. And that's why guys get, addicted to these pharmaceuticals and opiates, because I tell people all the time, I've seen a lot of guys leave the game addicted to opiates, but I've never seen a guy leave the game addicted to marijuana. And I just think, if the NFL is a perfect league, it's the biggest league. And Roger Goodell has a saying that, we are going to follow the science. They need to lead the science. They lead the science, it could go a long way to ending the prohibition and get rid of this reefer madness negative connotation that was engineered by one guy in the government.
Yeah. And those who do treat with cannabis, are they failing drug tests? Because I know the NFL subjects players to testing for drugs, don't they?
Well, the thing is the NFL tests for drugs once a year, and it's about this time in July, and so we call it an intelligence test, because if you fail that test, you're not that sharp. So what guys usually do is they take off the month of June and July, those 7 weeks between the end of minicamps, official minicamps, and training camps. They work out and they get themselves, they just lay off of it and get it out their system. And then they know within the first 2 weeks of training camp, the drug test is going to come. And then after it comes, it's like 420 in the dormitory during training camp, because guys know that that's their only time they're going to get tested. And, so like I said, the guys that get busted, it's an intelligence test. But there are, guys that smoke regularly and been smoking since high school and college, and they know how to test negative for that one test, and then you have no issue.
Right.
Marvin, I think
go ahead.
We can ask Josh this weekend things like that. I believe Major League Baseball doesn't even test for marijuana. Is that correct?
No, Major League Baseball doesn't. Hockey doesn't, and the NBA tests if they have a probable cause, like if you get, found at the airport, like these guys be doing with, marijuana in their bag, or they get stopped by the police and they have, smell of marijuana, then the NBA, they can test. But, that's why you don't see a lot of NHL guys or Major League Baseball guys getting caught for marijuana, because they don't test for it, unless it's a probable cause. And this has to be led by the union. Everybody says, we're going to go to the NFL, Well, whenever you have some type of safety or health issues in the industry, be it auto, be it trucking, be it coal mining, the changes and the initiative for better health and well-being of the workers has always been initiated by the union. And this is something that's going to have to come out of our union, and I'm pushing for that. I'm definitely pushing for that, because, the union is the body of players, and they're going to have to ask for it. And if enough guys ask for it, like I said, I think this thing is going to change.
The other thing is we actually, is having pain clinics and things like that. And I'm an interventionist and surgeon also. But the CDC guidelines that came out this spring, they actually have notations in there that says that they're not really sure that we should be testing for THC in our regular pain patients or laymen out on the street. So obviously, if the federal government is looking at it and says we shouldn't even be testing for it, along with all the scientific research that's coming out, the benefits, I think things are going to, like you said, going to change in the next year or two in almost all 50 states.
It seems like it's got to change. I mean, it's inevitable as the science comes out, the laws are going to wind up having to catch up with the science ultimately, don't you think?
Well, I think, this thing is happening, and it's not a matter of if, it's just when.
Yeah.
And I know the DEA it has this under review for whether they want to reschedule it, but and this election coming up too may play a big part. But I think the momentum is behind it. But if you look even across the political spectrum of the legalization of marijuana, you have Democrats, Republicans, and Libertarians. Everybody, like the Koch brothers out there in California, and they're very conservative and very libertarian. Well, they're for the legalization of marijuana. And, senators like Cory Booker out of New Jersey, I know they're looking into it. So it's going to happen. But it will be real it would have a lot of influence if the NFL came out and said they were relaxing their standards and they were going to study it, because, like I said, the NFL is, it moves the needle. Whenever they do something, it moves the needle. And so I would like for them to lead the way instead of following it, but a lot of people are caught up into their ideology, and I understand that. But the only thing I have to say is follow the science. If you follow the science, you come to a logical conclusion that this plant has medicinal benefits in so many ways. And this is not anecdotal. This is like science. This is people that have, with the kids with the epileptic strokes and seizures, and people who had, the after effects of chemotherapy and all that. The medicinal benefits are there, and I just think a sports league that needs to lead the way is the NFL.
Yeah, especially with the neuroprotectant qualities as well, which something, Dr. Tokin, I think maybe you could address even better. Describe CTE, chronic traumatic encephalitis, or
encephalopathy. It took me a while to get it down, too.
Exactly.
Yeah.
I was thinking also when you're talking about all the neuroprotective benefits of the medication, there's even Dio has a product out that we've seen that seems to be helping with anxiety and stuff. All these physicians are prescribing benzodiazepines like Xanax, Valium, Ativan, Klonopin, when you're not supposed to be mixing those with the opioids anyways. And most of the overdose deaths are the combination of these deadly medications together. If they had an alternative other than the benzodiazepines, the number of overdose deaths would go down significantly.
Wow, that's something I didn't know.
That's something I did not know. That is something I did not know, but I kind of figured it was in there because I have guys, ex-teammates and peers that I played with during my period in the NFL that, they're having these cognitive, these closed head injury symptoms, and the doctors are treating them, with Alzheimer's disease medicine and dementia medicine, and plus they're treating their body and their pain with opiates. And I just, like I said, I'm trying to get as many guys as I can to try the cannabis alternative in the states that it's legal in and what have you, and get guys on CBD and get guys on, maybe a combination of both and give them the entourage effect. But these opiates, man, they're eating at the fabric of America, and in the sports league, it hasn't came out. We haven't had the overdoses that we've had in the entertainment field, but it's eating us up, man. It's eating at the fabric of America, and something has to be done.
Yeah.
I agree.
Even David Kessler, who was the former head of the U.S. FDA, said that it's been one of the greatest mistakes of modern medicine to continue to proliferate the fascination with opioids.
Yeah, I think, like I had mentioned before, I think it all, when it gets down to it, I think it needs to come back to the responsibility of the physicians. And, many physicians don't like to be told that they're doing something wrong, but they are. So we need to get the physicians to stop prescribing all these horrible medications, send them to other alternative therapies, physical therapy, interventional pain procedures, using CBD and all that kind of good stuff. But it has to be the responsibility of the physicians to stop this, and then they have to stop prescribing medications that, like I said, with the benzodiazepines, where they work together and slow down your breathing and you don't wake up in the morning. So there's a lot of things that the physicians have to take responsibility for and put an end to it. But we have an alternative, so I think we need to really start exploring that a little bit heavier.
Yeah. How often do you see articles about this in the Journal of American Medical Association?
If anybody would Google the subject like benzodiazepines and opioids, it's you find it all over. But a lot of the national associations, like the Psychiatry Association, says you shouldn't be giving chronically benzodiazepines for anxiety, post-traumatic stress disorder, panic attacks, or insomnia. But you have to understand, most of the physicians say if you go to your waiting room, you're waiting there forever, and then you get to speak to the doctor for like 5 minutes. So the patient comes in, the doctor wants to address the diabetes, high blood pressure, and high cholesterol. The patient, the only thing they're concerned about is their pain. So what the doctor does, their pain and their anxiety. So what the doctor does is quickly take that off the plate by refilling their medications for pain and anxiety when they spend the rest of the time taking care of the diabetes. So no one's ever putting an end to this madness of prescribing opioids. And patients that go to family practitioners and are prescribed chronically opioids, 1 out of 4 has an opioid use disorder, has an addiction problem. So we need to change, the way we're treating patients' pain and take a multidisciplinary approach to everything and start using things that can decrease the amount of opioids we're using in general.
Right. And aren't there new guidelines, too, about the overprescribing so that doctors cannot re-prescribe or refill prescriptions over a certain amount?
Well, there are CDC guidelines that came out this spring, and there are recommendations for family practice or primary care physicians regarding the amount of narcotics they think that is reasonable. Some physicians, like a board-certified pain physician, they can pretty much write whatever they want to. They're just guidelines, but they really need to enforce it. And I believe that the family practitioners, if they follow those guidelines and get them to other ways they can take away their pain with physical therapy, chiropractor, acupuncture, surgery, interventional procedures, and follow the guidelines, it's a start. That's the best thing is a start. And the doctors will realize when they look at the total amount of milligrams of oxycodone, Percocet, hydrocodone that they're prescribing, when they look at compare that to the government guidelines, they'll see how out of line they are, and hopefully it'll make them open their eyes and start looking for alternatives. And CBD and medical marijuana is a very good alternative.
Right, but also with these new guidelines, too, we're seeing a whole new crop of addiction regional throughout the United States, and where people are starting to turn to the street versions of opioid pain medication like fentanyl or heroin, really, for that matter.
Absolutely. Some of the patients that were prescribed narcotics in the past and their doctors now are washing their hands of it and don't want to. It's such a scrutinized thing to write an opioid these days that a lot of the doctors are saying, I'm not doing it anymore. So people are going to street drugs like heroin, and a lot of times heroin is laced with fentanyl. And I know there's been a lot of recent publicity about pain pills that look like Percocet or look like Lortab or Norco, where there actually are fentanyl pills just with stamped, they look exactly like Percocet. So there are a lot of overdoses that happen with that also. The opioid epidemic is just huge, and it's destroying the nation.
Yeah. And it's not just people that you would think would have that problem. I mean, we're talking grandmothers and teenagers. And
we treat attorneys, we treat physicians. It does not discriminate at all. And as Marvin can probably tell you, I was never on the level. I ran on a track scholarship at Virginia Tech, but this could happen to any of us. Marvin could twist his ankle walking out to his car now. Next thing you know, they put a plate in his ankle. They start him on Percocet, and you just 6 months later, you're not off it. It's a disease, and it does not discriminate at all.
Yeah. Marvin, I did an article a little while ago, a couple months ago actually, talking about Eugene. Forgive me.
Eugene Munroe.
Yes. And he was actually putting some money into research that was about to happen. But he was talking about how players would just line up for their tee shots and injections, pain medicine injections, as almost a regimen, a regular part of business as usual in the locker room. Was that something that you experienced as well?
Yeah, that's the way it is. That's the NFL, man, and that's part of the game. And I hate to say this, but I don't know how you can play in the NFL without something that you're taking from pain management.
Mm-hmm.
And so my thing is, why not take something that's natural, comes from a plant, non-toxic, non-addictive, none of the negative side effects that you're going to have on, your liver and your kidneys, and let's try it. Because here's the thing, is that the NFL gives guys exemptions who have ADHD and ADD with their Adderall and Ritalin and things like that. So they make, and they call it, and I say TUE, I'm sorry, I didn't explain it, a temporary use exemption. So my thing is why doesn't the NFL try it with marijuana? You know, with the teams that in the states that it's legal, like with the Broncos and with the Seattle Seahawks, and do a small clinical study group with maybe 10 guys on each team, and instead of doing the anti-inflammatories and the opiates, and if you're going to do the opiates, then do it with a combination of cannabis and the opiates, because they work well. You know, marijuana works well with painkillers, but instead of having that high dosage, have a low dosage and a high dosage of indica or sativa, and see how that works for the player. You know, because you have to get it down, because how can you go through a regimen from July to January and not be addictive?
Yeah.
You know, I was in NFL. By the time I left, I could write my own script. So instead of going to the doctor, to the team doctor, and letting the team know what I was doing, I would go to my own doctor, just like everybody else would doctor shop, and get my own script. So, but before the season started, I already had 400 Indocin. I already had 400 Percocet. I already had 400 Tylenol 3s. You know, because I knew how to medicate myself, and I know that's not the way it's supposed to be, and that's not good. But there are a lot of veterans like that they have their own doctors and they can write their own script. Right. But as far as lining up and getting the shots and getting the pain blocker and pain pills before and after the game, that was the NFL. But I think the NFL needs to look at marijuana for pain management, and then they need to put some money behind the sign, because they have an industrial disease, and that's CTE. You know, and that would go a long way, you know, because it's a closed-headed injury, PTSD, MPTSD, pugilistic dementia, whatever it is, it's a closed-head injury. If the NFL could lead the way, it would get other people, other leagues behind it. It'll bring in more corporate dollars, and you know, we can go along. It would go a long ways to solving the NFL's industrial disease problem, which is CTE, because Roger Goodell's always talking about, you know, we want to protect the shield. Well, how do you protect the shield? You can't have your former players walking around with these issues, with these mood and behavioral issues. And knock on wood, we haven't had a death this year, you know, from a suicide from CTE, but you know, we were averaging 2 a year. And I know that may not seem a lot, but for the NFL, that's a lot. So, you know, like I said, I think the NFL needs to get behind the science of it. And that's where I am on the scientific basis of the cannabis plant. Get behind it, study it, research it, and see how it can be a benefit to your players and society.
Yeah, I couldn't agree more with that. Well, and also cannabis treats so many of the other conditions that would require something other than just the painkillers, you know, the anxiety meds. I mean, it's effective in treating PTSD and so many other conditions. So, I mean, Dr. Tokin, do you agree with just about everything that Marvin just said?
Absolutely. Full-heartedly. I think there's and the things that we do know that it treats right now, I can guarantee in 5 to 10 years we're going to have 4 times the number of medical conditions that can be treated with the plant, all-natural plant. I think we're just opening up the can of how we can use this plant to solve things. I have a couple research projects, actually, we're going to be doing with the CBD, and I think, like I said, 5 years from now, this is just a starter.
Yeah, can you talk about some of your research studies?
A lot of them have to do with the pain and with the addiction problems. I'm still making some connections and some contracts with one company where we could possibly use the cannabis plant. I really can't talk about it right now. But in all of our clinics, in the elite pain clinics, we use it for the pain, for the anxiety, for insomnia. It's very, very good for insomnia. So in addiction, the biggest thing that it's, people with pain, as Marvin can probably tell you, they're in pain all the time. Anxiety and depression are all wrapped up in one. Mm-hmm. So a lot of our research and questionnaires, and have to do with how the improvement in your insomnia, your anxiety, your depression, and it's pretty remarkable. It's just an evolving science that's going on now, but it really would be nice if the NFL and would stand behind their players. I have some friends through some connections. I won't give out any names here, through the NFL and things, and they tell me stories about their former teammates who are walking around today, obvious with some mental impairment from the CTE and everything, and we just, keep on urging, and hopefully Roger Goodell will help out with the NFL, and we can get Major League Baseball and the other pro teams to join in.
Yeah. Well, it sounds like the ball is rolling right now.
Well, it's definitely rolling in, and if it's closing out, I just want to say, like, a lot of people in the industry are like, and I won't even call this the industry because, it's not like tobacco industry or liquor industry or anything like that, but it's going to become an industry. And the thing is, a lot of people in the industry are saying, well, when Big Pharma gets into it, it's going to ruin it. To me, I think that's a misnomer, because I don't think they're going to get in and you can't change the will. I think we need Big Pharma and these big corporations to get in it, because like they've always done, they advance the science, they advance the research because they have the dollars to do it. Mm-hmm. They're not going to reinvent the wheel. And the people that are doing it right, the people that are doing it just not for profit and trying to help people, they're going to be in the industry. The people that are doing it wrong, and there's a lot of guys in this industry that are doing it wrong, they're going to get out when it becomes an industry, But I welcome all the big corporations and the big pharmaceuticals and big tobacco to come in, because I know they're going to take this thing to another level. And so people like Dr. Tompkins and all these other companies, you just got to be in position to when they come in and ride that wave, everybody's boats rise. When the tide comes in, everybody's boat's going to rise, because I just think, this thing is going to take off within the next 5 to 10 years. In 10 years, it's going to be really exploding, and we're going to see the benefits. And like Dr. Thompson said, there's going to be, how many other diseases and ailments that it can help. And so I look forward to that. But for right now, I definitely want the NFL to get behind this, NFLPA.
Yeah. Well,
I think the key right now is just getting legitimacy to the industry, as Marvin was saying. And my wife's a physician also, and I remember the first medical marijuana conference we went to. We were going to bring it into, I had done so much research on it and thought it was a great idea. We went to a conference, and the thing we disliked is the moment we walked in the conference was, there's a good percentage of people that just do it recreationally. And when I approached isodiol, we were talking about you need to have physicians behind this, and you need to have some scientific data and things. You just can't have people running around recreational use. If you want this to be accepted and be voted legal in these states, you have to have the science behind it, and you have to present this medical treatment as in a professional manner. You don't need to just present it as people trying to get high all the time, when it has such so many benefits to help so many medical conditions. So one of the things that I was trying to help isodiol is actually bring it to the market where we can actually present it in a very, very professional manner and present it to physicians and other healthcare providers as a legitimate, that's the key, legitimate and responsible way to treat pain, anxiety, post-traumatic stress disorder, and who knows what else.
Mm-hmm. And I think also getting over the hump for pharmaceutical companies. Marvin, you were saying that once they get into this, it's going to bring a certain level of legitimacy to the industry as well when it becomes an industry, as you say. But I think that there's that initial hump that we have to get over, because I think pharmaceuticals, for the most part, at the moment, are quite threatened by it, because it's going to render a lot of their drugs that treat pain and then the drugs that treat the side effects and all of those drugs sort of obsolete.
Well, it should, and the thing is, it's like the companies that can adapt, they just won't be around. Mm-hmm. there were, and the thing is as Steve Jobs said, there's innovators, imitators, and idiots. The innovators are AOL, maybe MySpace. Imitators are the Google, Facebooks, and then the idiots are trying to copy it. I think the pharmaceuticals got to come in and be very good imitators. Mm-hmm. And the ones that don't adapt, they're going to go by the wayside because this is going to be, a 21st century deal. And so 50 years from now, who knows who's going to be around, but you have to adapt. Because I know that some of the alcohol and liquor companies that were around at the turn of the century and didn't adapt to post-prohibition, they're no longer around.
Right.
So they have to come in and adapt. And if that part of their business goes away, then it goes away. Mm-hmm. I think that's going to be good for the company. I think it's going to be good for the industry, and it's going to be good for society. If they're still trying to push pharmaceuticals when you have this natural plant that other companies are out researching and studying and getting the benefits out of it, and you're still trying to go with these addictive pharmaceuticals and opiates.
Yeah. Well, I think that, hopefully they will begin to adapt sooner rather than later, because I think that the lobbies are very powerful, trying to prevent the legislation too, from what I understand. But it'll be really interesting to see how this all pans out, and I will follow what happens at the NFL, certainly, because I think that you're right. I think that if an institution as large and famous as the NFL can get behind this and really start looking at it, I think that you're right. People will follow, and I think it'll be good for everyone if they do that. So.
Well, they look at, NFL as these guys as heroes. So they'll see, and, everybody say, playing a kid's game. It's not a kid's game. It's invented by a man, played by men, and kids emulate that. Mm-hmm. And if they see their favorite quarterback, vaping, to keep his brain safe and vaping some CBD, and this is something that CBD is something like a 28-year-old NFL quarterback can take and a 12-year-old Pop Warner kid can take. Mm-hmm. And it'll have the same effect on them. It acts as an antioxidant and neuroprotectant for the brain.
And anti-inflammatory.
Exactly. And I think the NFL needs to get behind that.
Mm-hmm. I think so too. Well, it's all, the science behind it is all very exciting to watch. I mean, so many things are unfolding right now, and I think we're in for some big changes coming up here pretty soon.
I agree, and if I'll have to give you my contact information off the air here, and see if we can possibly even set up some kind of nationwide internet questionnaire regarding. It won't be an official research project, but I bet you we could get some questionnaires and have people try CBD and see what their responses are, and write it's called a white paper with a synopsis of how people are doing, and just kind of open up the eyes. I'm sure we could get tens of thousands of patients to actually try CBD that are inquisitive about it.
I would love to communicate with you about that as well. And, on a political level, too, we're very interested in talking to, getting roundtables together and doing debates as publicly as possible with the people who are still talking about how it's a gateway drug and it's addictive, and they're really resisting and putting a lot of pressure on our state governments and our federal government as well to keep it illegal in terms of recreational use. But there are a lot of reasons why the overall legalization is important, because some of the medical laws are so restrictive and they don't allow people to use it for conditions that we know for a fact it will treat. So I'd love to stay in touch.
Yeah, that'd be great. I actually was on a roundtable with Senator Claire McCaskill out of Missouri 2 weeks ago, and they were talking about the opioid use disorder addiction problem in the United States. Missouri is actually the only state in the country that doesn't have a pharmacy prescription monitoring program where we can get on the internet and see where the patients are getting all their medications, see if they're doctor shopping. So they were very fixed on that, which Missouri does need to adopt that legislation.
Mm-hmm.
But what I was, as I mentioned earlier, what I was trying to really explain to her is it's just not having a pharmacy monitoring program, it's the physicians.
Right.
I think we really need to hit the physicians and get them educated and have them stop the prescribing practices they have right now.
Yeah. And a white paper is a great way to get their attention, too.
Oh, absolutely. And if I'm serious, if you would like to get together and actually set up a little website where we can have patients try CBD, we can have them basically click what kind of disorder they, obviously have, and I'm sure we could come up with some compelling evidence and then possibly write an IRB and get an official research study going across the country.
Yeah, I agree. Well, let's definitely talk about this. And, wow, well, there's a lot to absorb here. So this weekend, both of you will be attending the Southern California Cannabis Conference and Expo over in San Diego, right?
Yeah, we'll be there. And Dr. Thompson, please bring me some samples of CBD because I'm a big believer in it. And here's the other thing is that I have a lot of friends and teammates and family members and whatever, they reach out to me. I had a teammate reach out to me a couple months ago, and he was taking 8 Percocets a day for his pain management. And I'm definitely trying to dial in that and get guys off of that and try this. And a lot of guys, like I said, they're caught up in the ideology and thinking, reefer madness and all that. And that's not the way it is. And any way that I can push this movement forward, I would love to. If you want somebody to debate somebody, I can show them examples of and get guys and even myself, the guys that had to sacrifice to get to the NFL and get to college and made good grades and got a college degree, but, smoke recreationally. And, I don't feel that I'm any worse for the wear. And I know what's more dangerous than marijuana. If you ask any police officer or sheriff how many domestic violence calls he's been in that involves alcohol, he'd probably tell you 90%, but how many involve marijuana, he'd probably go 9. Yeah. And so I'm very dialed in on that, and I debate anybody. So anything that I can do to move this movement forward to Dr. Tompkins, I would love to. And just let me know, and hopefully this is the start of a good relationship to move this forward. And I definitely appreciate this platform. Anytime I get a platform to speak about it, I definitely do. And Snowden, if there's anything I can do, just let me know.
Thank you. Yeah, I appreciate that. Well, I so look forward to meeting both of you in person this weekend at the Southern California Cannabis Conference and Escrow. And, thank you both so much for...
Marvin, I'll get some of that CBD for you from isodiol.
Okay, definitely. Okay, guys, I got to run, and I'll see you guys weekend, and let's keep this on board.
Yes, absolutely. And we'll talk to you both very soon. So thank you again. All right. Well, thanks to all of you for listening today. I'd like to personally thank Dr. David Tokin and Marvin Washington for joining us today. Wow, what a big topic. And you can look forward to seeing them if you're in San Diego this weekend at the Southern California Cannabis Conference and Escrow. And the tickets are available actually at SoCalCCExpo.com. And please visit us at thecannabisreporter.com to learn more about this topic and to download today's show. I'd also like to thank Kyle Pratt, our amazing engineer, for hosting the show with us today. It's a little bit more complicated when everyone's in different parts of the world. But thank you all for listening. I'm Snowden Bishop, the Cannabis Reporter. Over and out.